Morning, everyone. Welcome to Behavioral Health. I'm so happy to be here with all of you. Sorry, I need to put my glasses on. Madam Clerk, would you please read the letters from Speaker Tate?
Dear Mr. Clerk, I'm making the following changes to committees for the 102nd Legislature. Representative Carol Glanville will be removed from the Health Policy Subcommittee on Behavioral Health. Sincerely, Joe Tate, Speaker of the House. Dear Mr. Clerk, I'm making the following changes for the 102nd Legislature. Representative Peter Herzberg will be added to the following committees. Health Policy Subcommittee on Behavioral Health. Sincerely, Joe Tate, Speaker of the House.
Thank you so much, Madam Clerk. We really appreciate it. Well, welcome to Rep. Herzberg. Madam Clerk, will you please call attendance?
Chair Brayback.
I'm here.
Representatives Arbit, Pahutsky. Here. Edwards.
Here.
McDonald.
Here.
Reingans.
Here.
Herzberg. Schmaltz.
She left the zoo.
Oh, okay.
Hoadley.
Here.
St. Germain.
Here.
Thompson.
Here.
Madam Chair, you have a quorum.
Thank you so much. Rep. Reingans moves to adopt the minutes from the April 25th meeting without objection. The meetings are adopted. Folks, we're in for a treat today. So today we have Leo with us, and they have done incredible work looking at kind of the landscape of mental health and the workplace throughout the state. So we have Sean Egan, the Deputy Director, we have Jayshona Hicks, the Legislative Affairs Director, and we have Randall Harrison, the State Assistant Administrator. We're very excited for all of you to be here. Please come on up and share your work with us. We can't wait to hear it.
Thank you. Good morning, Chair Braybick and committee members. Thank you for the opportunity to allowing us to present today. My name is Jayshona Hicks. I am the Legislative Director for the Department of Labor and Economic Opportunity, known as LEO. Here with me today is Sean Egan, who's our Deputy Director for our Labor Division, and Randall Harrison, who's our State Assistant Administrator for the division. As you guys know, working people spend most of their, precious time and energy at the workplace. And knowing that workplace safety and mental health is critical for strong workplaces and a strong workforce. Here at LEO, we have been taking a closer look at the mental health piece. Back in 2022, the governor tasked LEO with a task to formulate a work group dedicated for mental health, resiliency, and trauma. And from that work group, some key findings were put together in a report, including 9 recommendations. And today, Randall and Sean, they will share some of those recommendations, kind of also share with you some of the recommendations that we have already started working on, kind of focus in on some key data associated with mental health in the workplace, and lastly, end on where do we go from here, in hopes that this will raise awareness and also provide interest to you guys, so our legislative friends can kind of join this. So without further ado, I'll kick it over to Sean.
Well, thank you, Jayshona. Thank you, Madam Chair, and thank you all for having us. We don't get to see you very often. The Department of Labor doesn't really intersect, or doesn't seem to intersect very often with the Behavioral Health Committee, but we think we do, and that's why we're here today. For those that aren't familiar, in what we call labor within the Department of Labor, I primarily oversee MIOSHA, Workers' Comp, Wage and Hour, and the Bureau of Employment Relations. So we work with employers and employees and other groups across the state. We are literally in every single workplace. So that's why we believe it makes so much sense for LEO to really take a lead on this, because we're already connected to all the groups we're trying to get to. I think, interestingly, as Jayshona said, we started in about 2022, and I do want to point out, I know that you all hear about a lot of great work that's happening. And our goal was not to sort of replicate or replace any of that. So we didn't really focus in on people with known disabilities. We have areas of our department that are doing that. We have areas in DHHS that are doing that, and they do a great job. So we really focused in on where are individuals at in the workplace, what can employers be doing, what impact would this have on workplace, and frankly, how do we better identify and prevent potential mental health issues. So we had that work group put together of big business, small business, labor unions, and a bunch of experts from psychiatrists to organizational psychologists. And we spent a couple of months just digging through data. One of the challenges and one of the recommends from our work group is around data, because you have the report with you. All of the data is basically national data, and that's what you find, and you probably deal with that too in the other work that you see, that it's really an amalgamation of a lot of data from across the country. Now I can tell you the only thing we can say is there's no reason to believe that Michigan's any different than the data that we see, but we can't tell you exactly what's happening in Michigan. So one of the recommends for the state of Michigan is to start to build those data tools, and one of the programs we'll talk about a little bit today, we think we can start to help with that. We released a report in June of 22, and one of the other recommends was to build a resource hub and then do education. That was the third one. So in January of 23, we launched a resource hub, which in government parlance is a fancy name for a website, where we have all of the stuff we're doing, the reports and everything else, as well as any webinars or other information we develop. And we launched a monthly webinar series at the same time in January of 2023, and we cover a host of topics. It's really cool and a lot of fun, and proud to say that each and every month we have a couple hundred people jump on from a small business, HR, government, you name it. So we do have a pretty broad reach out there. We also had more than 60 speaking engagements across the state of Michigan last year, all across the state, UP on down, with different chambers, different labor unions, different groups, very, very interested in this topic. Big associations, some individual employers, and we're on track to have more than that this year, just focusing in on these topics. And we have this is a really cool issue in the sense that everybody's on board. So we had not only the MMA on the work group, Michigan Manufacturers Association, we have letters of commitment and support from SBAM, Michigan Manufacturers, the Michigan AFL-CIO, and the Michigan Building Trades. So that's an issue we like, right? That where everybody's kind of coalescing around this concept and sees this as a critical and valuable piece that we're focusing in on. So I'm going to run through our slideshow relatively quick. I'm somewhat nimble, I think, so I'm happy to kind of take questions as we go the best that we can. There's a lot of data in here. It's all in the report. You have the slides, and we're happy to talk about it over and over again. But just to kind of reaffirm the 9 recommendations for the state of Michigan, one of the first and foremost was for us as an employer to be a model for other employers out there. We do a lot of great things as an employer, but we're doing things internally now to be more focused on the concepts that we're going to run through in this slide deck, including integrating sort of mental health first aid training, some other employee resource groups, and some other things that we're trying to do to recognize some of the challenges that we have. I can run it. It's okay. Thank you. I appreciate the help, though. So where we started in the work group is, if you go way back, the World Health Organization actually took a look at workplace mental health probably in around 2004 or 5, and they kind of identified this framework of the 4 different pieces. I think for a lot of us, you see a bunch of circles and you expect there to be something in the middle, like a Venn diagram. There's nothing in the middle here. It's more sequential. But what they kind of tell you is, first and foremost, you have to get that physical safety right. Creates a certain amount of stress for people, and if you're not focused in on that, it's going to be a real challenge to get into things that make their mental health improve, because they're going to come into the workplace fearing for their health and safety to begin with. So we do that really well across the country. We do that very well in Michigan. You know, injury and illness rates are very low. We want to do more there. And then you kind of move into the psychosocial work environment and then personal health resources. When we talk about psychosocial, which we'll focus in on, we're really talking about things in the workplace that make a difference, that can impact people positively or negatively. And then personal health resources. You'll hear me say this a few times during my presentation, that there were quite a few head slap moments for me during all of this work that we've been doing. And I thought we all had parity, and that, you know, you had to have benefits that were equal and all this kind of stuff. And now I see you shaking your head no. Now, that was one of my head slap moments of like, what? That's really how it works? And you recognize that medical benefits often are much different than mental health care benefits. In fact, one of the construction employers that we've worked with, saw in their program, you had your normal sort of like $250 deductible, $500 whatever on the medical side, but it was $2,500 on the mental health care side. So that employer took it upon themselves to just cover that $2,500. They had difficulties changing the plan, but they set up a reimbursement model. And it was, you know, so when we talk about personal health resources, it's looking internal at what you're offering in that space to make sure that you're not creating a burden or a barrier to using mental health resources based on cost. I think for all of us, we know that cost drives a lot of behaviors. The big head slap moment for me was this concept from the experts. And I spend a lot of time with any group I'm with talking about this, and it's really critical to how we operate. If you look back at my bio, I'm a journeyman electrician by trade. So I say wiring and short circuit all of the time, so be prepared for that. And what was so head slapping for me in this is that, especially as a man, I'm going to claim that I'm young, but I'm in my mid-40s. And when I grew up, you know, you kind of learn to keep your head down, keep moving forward, don't talk to people, get over it, pull your boots up. And I think women deal with that too. So I'm just kind of talking about what the construction industry looks like. And you kind of always think maybe there's something wrong with you. So we got into this concept of what stress does to your brain. And interestingly, and what I love to tell everybody is what the experts have taught us is we are all wired the exact same way to respond to stress. And what happens is anytime your stress response activates, that little amygdala down in the back of your brain activates, and that controls all of those things that we've heard all of our lives, the fight, flight, or freeze response. It puts that cortisol and adrenaline through your body. And the basic premise of this amygdala is to protect you from what we use as the example, the bear in the woods. If you see a bear in the woods, this is going to activate and probably save your life, right? You're going to get super strong or fast or whatever. It's going to tell you what to do and how to respond. And that's going to activate the hippocampus, which is where emotions and sort of stored memories come from. This will all make more sense in a minute. And it's going to actually short circuit your logic center. So when your stress response activates, you are no longer reacting logically or rationally to a situation. And that can come from a lot of places. We think about the bear in the woods, and it makes perfect sense to know this stress response is supposed to get you to safety, and then the stress is gone. But when that carries, when that stress stays with you, this response continues to be activated. So when we talk with employers and workers out there, we talk about there's nothing wrong with you to begin with. If you are stressed, whether you want to or not, this is the response that you're going to have. Your logic center is going to deactivate for the most part, and you're going to be reacting on emotion and stored memories. So if you had adverse childhood experiences, you have stored memories of how you dealt with the stress. If you were exposed as a soldier, you have stored memories of how you reacted to different situations. And when that amygdala activates, your stress response kicked in, it's going to use those to tell you how to deal with this situation in front of you, even though they're not related. And the challenge with the amygdala, too, is it doesn't recognize the difference between stressors. So it doesn't recognize that the bear in the woods is not the same as the pile of extra work or the excessive overtime or the other thing coming into your life right now. So this is going to happen whenever that stress response activates. And the most important thing, if you remember nothing else of anything that I say for the rest of this morning, is this is automatic. This is not a controlled response. This is an automatic response to stress. And what happens immediately is you start to have things like anger and anxiety and body aches and brain fog and confusion. Now, when I talk about workplace safety and health, and I tell you that people are coming into work that are chronically stressed and they have confusion and brain fog, that's very alarming, right? It's very concerning, depending on the nature of your industry, but frankly, any industry. The thought of construction workers or production workers having brain fog and confusion with the stuff that they do scares the heck out of me, because they're going to become a risk to themselves and others, and it's not their fault. And the way that you see this is, you know, Sean was a great worker, and now suddenly Sean's not a great worker. And it's more than likely I never chose to stop doing stuff. I'm having a stress response, which could be work-related, could be personal-related, could be a lot of things. But employers need to understand that this is kind of what's happening. And the way that you deactivate the stress response is to get away from the stress. And then your brain takes its time to heal. And what happens if this chronic stress continues to drag is you start to have actual physical changes and physical health problems. Because we all know adrenaline is not intended to be a long-duration chemical in your body. It enlarges all of your organs. It makes your heart beat faster, as we all know. It makes your lungs operate a little bit differently. makes you a little bit stronger. You know, we always hear about mom picking the car off the baby, right? But it's supposed to be over in a short amount of time. As long as that stress response is activated, there's some cortisol and adrenaline rushing through your body. And what you're gonna have there is severe health outcomes, physical health outcomes from the chronic stress that you're enduring, which includes all the things you can see here and in the report, things like diabetes, hypertension. It can also push you to addiction. But the most common outcomes are anxiety and depression, which is interesting. Now, as, again, a young person, that was a joke. It's okay to laugh. I tell everybody when we start, we're talking about heavy stuff. I think I'm funny. It's okay to laugh occasionally if you so choose. When we heard the phrase mental health, when I was growing up, it meant something permanent. It meant something possibly genetic. And it meant that it was lifelong and somebody was going to be dealing with this. I think, hopefully, I'm smarter now, but I think we're all much more aware now that that's not true. That mental health issues can just come and go. That depression doesn't necessarily mean it's permanent. And about a year ago, Stanford Medicine actually said they believe they could tie maybe 40 to 50% of the depression in our country to genetics, which means 50 to 60% is coming from somewhere else. So when I'm sharing with you that chronic stress causes these things, the most common outcome is anxiety and depression, it becomes a little more clear to us that we have to talk about chronic stress, the stress response, anxiety and depression, and resources. In the pandemic, and this is partly why we started doing it in 22, the pandemic was hard on us all. There is sort of like a natural disaster psychology that we all deal with as a group, where we kind of go positive, negative, and then slowly but surely you start moving back toward an equilibrium. But before the pandemic in 2019, CDC every year asks people across the country if they have symptoms of anxiety and depression. And as you can see, before the pandemic, about 11% reported yes. About a year into the pandemic, we're over 40%. So brain fog, confusion, inability to concentrate, all of that stuff is coming into the workplace. Now, the good news is in 2023, that total has dropped from 41 to about 32.3. But interestingly here, I like to point out the variance in age groups. So we see, and part of this is I'm going to talk a little bit about the work that we're doing on construction industry suicide prevention. Part of this is where are new workers, where are apprentices in this sort of spectrum of people dealing with symptoms, at least, of anxiety and depression. So literally, from CDC data anyway, half of these new workers are coming into the workplace in a condition that's not going to be conducive for them being successful. So what can we do to make that better, and how do we focus on it? It's big in this country, it's big across the world. The most important number here, and we think that treatment, therapy, individual behavioral health support is really, really important, but what I talk with workers and employers about the most is that 46% number. What you'll find over and over in research is that less than half of the people that could use help are going to go get help. So we start talking about systems. How do we create systems where we know there's positive outcomes, not knowing the exact extent of the positive outcome? We want people to get help. We also know that if we convinced everybody stigma was gone and the other 54% here went to get help, they can't get it, right? We don't have enough people to do the help that people would need. So we really want to focus in on systems, prevention, not pushing people to that point of anxiety and depression, because that takes stress off those community mental health resources we have. And it's also going to have positive outcomes for people that are struggling with an actual lifelong situation that they might not be telling anybody about. One of the other data points that I pulled out of this shorter presentation is that when less than half go seek help, only a third of those folks that actually go seek help are going to let their employer know. And that's the other thing for employers to understand too, is that this is in your workplace. You're dealing with this now, and less than a third are ever going to tell you that they're either getting help or they need help. So you really want to focus in on the systems. It's prevalent. About 83% of workers in 2021, Mental Health America, it's a great resource. They do a workplace survey every year, say that they're emotionally drained. Emotionally drained is important because it's that one step below burnout. It's like a sliver from burnout, frankly. And burnout is, in essence, sort of like shutting down, right? Your logic center is not engaged anymore. You can't function the way that you would normally function. So what are we doing about it? We launched the Resource Hub and all of that, a fancy website. We do the webinars. They're all posted there. All of our information's posted there. OSHA's in this space now too. So they launched their Resource Hub on workplace stress. That as a Department of Labor, that's really where our foundations are. As I mentioned, we're not trying to get into, we want to support it, but not develop programs around people with known disabilities. We really want to be in that workplace stress prevention spot. And then we have a specific focus on construction industry suicide prevention. And the reason for that, I think I pulled that slide, is that in the data, the construction industry is a major outlier from other industries as it relates to suicide. This was important to us in our work group because one of our folks was from the Michigan Building Trades and kind of in the first meeting told us all, we do a lot of stuff for workplace safety and health. And across this country in any given year, we're going to have about 1,000 trades workers die because of something that happened to them at work. But in that same year, 5,000 are going to kill themselves. And we don't say a word. We don't bring it up. We're not talking to anybody about it. We're not even promoting resources for people to find help if they choose to do that. So it was really important to us to really create this focus on construction industry suicide prevention. Now, what you'll see in the data, it's in the report, it's too high for every industry. I mean, arguably, we would say 1 is too many, right? But it's too high for every industry. And if you look at that 8 out of 10 in the report, 8 out of the top 10, they look like blue-collar type production jobs. So we have a more specific population that we're trying to reach there. Now, I will tell you that not in the report, but in the data, women actually attempt suicide more than men. But they're more likely to choose less violent means, which means there's a chance for rescue, which actually happens quite often. So women aren't off the hook when it comes to our suicide prevention work because there's a challenge there too, but we're seeing the actual numbers in certain industries. Now, if you break that down, because they align the data by the size of the workforce and all that kind of stuff, if you get to smaller industries, firefighters as a profession is pretty high. Percentage-wise, it's pretty high. So if everything were being equal, they would be right up there too. And there are other professions. So what that doesn't tell us necessarily that it's just the industry. It tells us what is the population of that industry, who do we need to talk to, and how do we communicate about it. So we kicked off with OSHA a Construction Industry Suicide Prevention Week. You may be familiar with like Fall Protection Week, Stand Down Weeks. This is one of those for OSHA and MyOSHA. First week of September during Labor Day. We've had a couple of events the last couple years, and we're going to keep having those discussions, and we've had great inroads. The construction industry is on board with getting this information into apprenticeship programs, into their workplaces or otherwise, because not only can we not afford to lose those workers from the industry, we need to make sure that we are the intervention point for those workers, because that's where we spend the majority of our time. So we spend a lot of time in the report, you all have it, on building the business case. We know that employers will see this as the right thing to do, but we also want to make sure that the math works, and the math does work. But the part of the reason that the workplace is the right place, as Jayshona said, that's where we spend the majority of our waking hours. My friend Randall always tells everybody on any given day he'll be connected to me for 8 hours. We may not see each other the whole time, but we'll be connected. And in the same day, with life and everything else that goes on, he might see his wife for 1. So really, who's better positioned to recognize challenges for Randall? It's probably me. Where's a better intervention point, and those kinds of things. The other reason, a couple of other reasons are that that's where workers say the stress is coming from. So if employers ignore it, they're kind of ignoring the number one place that workers say the stress is coming from. Now, I always remind everybody, I don't have stress buckets. I don't know if you do. You all have very stressful jobs, right? You don't have stress buckets that says, this is my home stuff, and this is my work stuff. It's all the same, and it doesn't matter where that stress response is activated or what's activating it. Once it's activated, it's going to happen. So whether it's all the workplace or not the workplace or whatever, it doesn't really matter. That's where workers say it's happening, and that stress response is still coming into the workplace. So that's where we address it. And it's the best intervention point. That's where we have all kinds of training opportunities, and that's where we are. So just on the last 6 months, this was from Gallup from last year, workers saying that in the last 6 months, my workplace has extremely or negatively, somewhat negatively impacted my mental health. And again, you see this sort of inverse by age. But if you remember that first graph, this one's much slower. That first graph was like as soon as you turn older than Jayshona, everything's puppies and rainbows, right? This one is much slower, but you do see a change. We know that work has positive mental health impacts, right? People like to work. They feel good when they work. So there is a change that starts to happen as you get older. But this is, again, more about apprentices, new workers, young people coming into workplaces and recognizing what they're bringing with them. I apologize for this slide. It's in the report. We can't ever figure out how to make it look nicer, but you'll see over and over again this concept of a $4 return for every $1 invested. And there's a lot of reasons for that. One is what we call the invisible cost, absenteeism. So somebody not dealing with depression will have about 8 sick days a year. Somebody dealing with depression is going to average about 27. Now, we know for a lot of workers that also means you lost your job. But even if you don't, that's a lot. 19 days of lost productivity for both the employer and the worker, lost income, all of that kind of stuff. The one we focus most on, though, is presenteeism. As I mentioned, all of these folks are going to come to work. And even when we say those dealing with depression will miss more time, they're still going to be in work all those other days. And they're going to have brain fog, confusion, inability to concentrate, can't focus, all that kind of stuff. And Tufts University spent a lot of time on this, and they found depression in and of itself was the most expensive chronic condition that employers were dealing with. And they calculated it out as about $109 per employee for every one person dealing with depression. And if you get way into their data, the way they did that is they basically said, we pay Sean X, his productivity went to this, and then we divide that lost productivity across the population of workers. And they also say that in any workplace, there's probably 10% that are dealing with depression at any given time. So these costs are happening. So if we intervene here for the bottom line, and the employers on our work group when we were working through this really heard this, that I can improve my bottom line by just making people better, right? So this is a real big area where we can have big improvements in the workplace, not only that impact the workplace in and of itself, but carry out into our communities. So we see this as the intervention point. And then, of course, job turnover is largely related to stress. So the good news, too, is about 71% are less likely to be experiencing burnout, so they're functioning well. 70% are less likely to search for a new job, so you get that retention piece that employers are looking for. 5 times more likely to advocate for you as the place to work. Recruitment, they get that recruitment taken care of because your current employees are your best recruiters, right? More likely to be engaged at work and thriving in their own personal lives. And then I want to touch on resilience, and then I'll move it along. But resilience is important. And resilience is this concept of teaching the individual how to respond to the stress response better, or deal with traumas or whatever it is they had better. What the experts told us, though, is that if I teach you to be more resilient, but I don't change the stressor, it doesn't matter. I can't teach you to just be stronger, but then keep pushing you back into whatever's causing the stress. We have to fix both. So we talk about systems. And the easiest example for this one for me, people living in poverty age faster, they die younger, they are chronically stressed. So if I teach somebody living in poverty how to be more resilient, but then I say just go back and live in poverty, it's not going to change the outcome. It can help maybe intermittently, and maybe it gets us to more interventions, but the gist is we have to focus on systems. So in the workplace, the example I always use is nurses. We know that nurses are burned out across this country, in our state. We know that there's trauma that they endure because of their work with families and patients. The excessive overtime, lack of time off, all of these things are causing a big challenge. So we can do the important things around resilience and how to de-stress, but we've got to talk about how we manage workflows. And we might not be able to change it all. I'm not saying we have to change it all. We understand that stuff has to happen. We know that night shifts actually hurt people's mental health. We might have to have night shifts, but we need to be aware that this is going to cause some challenge. We know excessive overtime, lack of schedules. We know a lot of things hurt people's health that we really haven't paid attention to. So resilience really is teaching ourselves to maybe not identify the stress, but recognize the stress and choose a better outcome. You choose the exercise instead of the beer. You choose healthy food instead of the cheeseburger. You take a walk instead of laying around. Like it's choosing better ways to manage the stress response. I think for all of you, we call it my stress button in my house, right between my shoulder blades, your spine starts to like tighten up on you. That's when you're kind of at your limit. So it's recognizing that and choosing something different. And our work now over the last couple of years is really honed into these 3 pillars, and this is what the next piece is going to be about. where we're focused in on things that are happening in the workplace. So that would be that excessive overtime, mental health parity, all those types of things, working with employers on that. And then those things affecting the workplace, because all those folks are coming into work. So poverty, racism, adverse childhood experiences, whatever else. So it's becoming a trauma-informed workplace for both your workers and potentially the customers you serve, and recognizing how they may deal differently with stress. They might respond differently to stress, and how you manage those types of situations. And then certainly we have been partnered with DHHS this whole time, focusing in on those individual behavioral health tools, because I always tell everybody, I can't make you happy. There is an individual responsibility here of using the resources that are available to you. And hopefully by battling stigma, we'll get people to take that step. And it's, I think we're having some success, but it's all connected. So we don't see ourselves leading the affecting the workplace and individual behavioral health supports, but because of our unique positioning with employers and focusing in on the workplace, we see kind of pulling them all together. So we did have 5 steps to start building resilient workplaces, and we said steps intentionally. This is a journey, not a destination. There will never be a checklist I can give anybody that says, do this, that, and that, and everything's fine. It's just never going to work that way. So these, assess your workplace culture, consider workplace practices and procedures, recommit to employee assistance programs. There's a real challenge here. In the data, nationally, only 4% of employees will ever use their employer's employee assistance program. So we're talking about why that is. Our friends at U of M have told us sometimes it's because employers choose that provider based on like business stuff. They've been in business for a while, they have good financials, I like the management, instead of what do they actually do. So that's one of the things. Often they're tied to HR departments. And whether it's true or not, and typically it's not, HR doesn't really get much information from any EAP provider. There's some confidentiality stuff going on there. But workers generally think the HR department's going to know, so they're not using those. And then if they are tied to the HR department, people are not going to tell you they're struggling. They're not going to tell their coworkers they're struggling. They're definitely not going to tell HR, because that's the people that are going to promote you, discipline you, recommend you, evaluate you, all of these kinds of things. To go to them and say, I have a problem, is not something that's likely to occur. Make sure you're engaging employees, and then consider adding, a lot of employers already have like these joint health and safety committees. Put this in there. We're talking to the construction industry when they're evaluating the hazards of a job. What is the stress? Where is the stress point on this particular project that we're going to do? Having been an electrician, maybe you all have, but being 150 feet in the air in a little basket is a pretty stressful situation, especially when the journey worker thinks it's funny to kind of move the basket around. But that's something that's going to impact your ability to perform that job. So add this kind of stuff to that. So from there, I think that was about the wrap up on that particular presentation. This year, last couple years, we've really been focused in on the education piece of this. This year, our focus has primarily been to the what do you do about it phase. So through our work group, the couple of concepts that we put together, and frankly, we're still the only State Department of Labor focusing in this way. So there's nobody to look to. We do like to brag that we put out our report in June of 22. The Surgeon General put out his in like September, October, so they copied and pasted what we did. I'm just kidding. See, that's what I think. But they're very similar, and the concepts are very similar. But we're still the only kind of State Department really pushing in this way. So we have conceptually strong support from business and labor to develop a consultation program that would focus in from our angle on the organizational psychology, organizational strategies, but pull in the trauma-informed training, the individual behavioral health supports. And we have commitments from just about anybody you can think of, but U of M, MSU, Corporation for Skilled Workforce, National Council for Mental Wellbeing. We're tied to Boston College, Cambridge, Harvard. We have a whole slew of people that are supporting the work that we do that are on what I call our kitchen cabinet, between psychiatrists, psychologists, organizational psychologists, and you name it, kind of helping push the work forward. And we think as an intervention point, the workplace is critical. We also think as reducing stress, the workplace is critical. And then we can really focus in on getting people to the stuff that they need and making sure we understand that these different types of traumas that we've endured have an impact on us, on how we function forever. Any women in particular, but any person that has had 4 or more adverse childhood experiences is more likely than not to struggle for the rest of their life with both job security financial security, poverty, addiction, you name it. I didn't know that, right? Head slap moment, that chronic stress they endured when they were young had this permanent impact on their lives and can change the way that you respond to stress forever. So we need to understand that. We can't fix that without addressing it, right? We can't just say, hey, you're older now, you've had all of this bad stuff happen, we're gonna help you now. We wanna make sure that we're in the workplaces keeping people employed, keeping the workplace in a position to employ people that they aren't used to employing that might have these kind of situations, and making sure that these folks are gonna thrive more in their own lives. So we have broad support for that. We've applied for a couple of grants. We're working toward that. We're excited about it. One we didn't get because they had a rule that no other department could get it in the last few years. So that last piece is kind of the summary we called Mindful Workplaces for a SAMHSA grant. That one breaks it down pretty easily. But conceptually, the goal would be to eventually build sort of like a MIOSHA-style consultation program where you're working with employers. We would do cohort employers. The two models we looked at were Chicago and New York. Chicago had a corporate-led model focused in on trauma, recognizing that people that lived on, I get the geography wrong all the time, but people that lived on the south side of Chicago weathered, aged faster, died younger, et cetera, et cetera. So how do we manage that trauma and make sure employers are trauma-informed so that we can get people and keep people employed? New York did one through their mayor's community mental health department, focused in on the organizational side. So Chicago did cohorts of employers, 15 at a time, 10 to 15, and New York did one at a time. And we want to put them together because we think having the department-led consultation is important to control content. And we also think having cohorts is good because you create competition among employers. Chicago's was, I wouldn't say expensive, but it was expensive. If you're a big employer, it's 50 grand. If you're a small employer, it's 5. All of the work we're trying to do with this program is focused in on small employers. We know that, not to call out names, but General Motors they have the money to kind of do whatever they need to do, right? But we know that our folks at SBAM that were on our work group, many of those are the HR director, the CEO, the whatever, right? Like they don't have time to develop these types of interventions. So we want to make sure that we're filling that gap. Then there'd be some other things we want to do with those partners that we have. They don't work for free, right? There's things that you got to do to get them to come in. And then some grants for smaller employers to be able to participate in a meaningful way. So I could go on for the rest of the day. As you can tell, you all are elected, so you understand that you can talk forever too, right? And I certainly have developed that trait in the last couple of years.
Thank you. Randall, is there anything that you want to add as well?
Thank you very much, Chair Braybeck and committee members. I would just say before this role, I did serve as the senior investigator with the Wage and Hour Division. So I was able to engage with thousands of employers as well as thousands of employees over my 16-year career with the Wage and Hour Division. And one common denominator when speaking with both of these groups would be the culture. Work is tied to someone's livelihood, how they're paid, etc. And the stress levels, just like the story I told you when we actually met Rep, the culture needs to be addressed. Just like Sean said, you can't pay your way out of it, but we do believe that Leo is the place to address a lot of these concerns. Thank you.
Thank you. Colleagues, what questions do you have about all this? Rep. St. Germain.
Thank you, Madam Chair. Just looking at, you had stressors, and one of them was climate change trauma. What does that mean? Do you mean like the recent, like our auto workers that are being laid off because of the rocky transition to EVs, or what does that mean?
Yeah, I think in the work group, I think what we were focused in on was sort of the constant news that we all deal with on like, we're all gonna die, all that kind of stuff, and kind of, I think we'd all agree, like, especially younger people, but social media is a challenge, right?
Yeah.
Part of that
Yeah.
50% coming into the workforce, part of it is that, right? So I think when we put something like climate change, it's just the continued news, the continued whatever. So there was no specific like, oh, it's that thing. It was just kind of lining out different issues that people and young people in particular are dealing with or hearing about. Yeah.
Okay, thank you.
Rep. Pahutsky.
Thank you, Madam Chair. Thank you for this. This was really informative and engaging, and I really appreciate it. On the piece about steps to start building a resilient workplace, I think that was all really, really amazing, but particularly around the EAPs, because I think that was a really important part that, having it there is not necessarily useful. So what are some of the things that have been more successful, if you know, that might be a very subjective question, but what practices around EAPs have been more successful? Like, is it services that are offered? Is it really about who has not necessarily access to that information, like you said, but the perceived access to that information? Can you expand on that a little bit more?
Yeah, for sure. So I think some of the other issues we see with EAPs is that a lot of folks like hire an EAP or provider or whatever else, and they just stick it in the handbook, right? There's no commitment to the actual program. It's just a checklist item for the employer for the handbook or something. Doesn't mean they don't care about it, but there's like a lot going on, right? So they go like, okay, I got that one covered, and just stick it in the handbook. So employers, we've heard some up north that have like 60%, and it's trust. It's, hey, we want you to use this. We're not evaluating what you're doing with it, and it's building in these other pieces like that. So trust is a big deal. Making sure leadership is promoting this, right, and having discussions about it, and potentially even using it and being bold about it, so that workers feel more comfortable using it. And it's a lot of angst and stigma that prevent people from doing anything.
Yeah.
So I think kind of those pieces have a big impact. But I would argue that trust is probably the most prevalent, and then making sure that it's visible. I think one of the things as an employer, as the state of Michigan, in our department, I can't say this for everybody, we are working very, very hard to make sure the information's out there and more posted, more available. It's part of the orientation instead of just in the orientation, that you break up orientation so you can get, we've all been in jobs, right? And you go to orientation, it's like this big pile of stuff you sign, and here's your benefit package, and you leave. It's being more intentional about what we're talking about with that. One of the fire department in Michigan that I talked with recently added a fifth. So they had 4 check-ins that you could do annually with their EAP. They added a fifth just called a wellness check to try to convince folks to just check in once a year. It's not a mental health appointment. It's not anything. It's just check in once a year, talk about stuff briefly. And I wouldn't say it shot through the roof, but they had a number do that. And frankly, for that population, much like construction, that might be the spot where somebody says, why don't we talk again? So that really was impactful and helpful. So I hope that answers the question. But
It
I mean,
does.
there's a fair amount of challenges there, but they're not insurmountable.
Sure.
And we can definitely make it more impactful.
Great. Thank you.
And colleagues, we have access to an EAP, so please use it. And the staff does as well. And so please take advantage of that. Now we have Rep. Thompson.
Thank you very much. This is very informative. There's tons of information. It's all about different types of work environments. Being a nurse, I love that you brought up nursing and the stress on nurses. Really looking to dissect all of this. Does Laura, when you talk about employment and employers and workplace, does Laura oversee state-run facilities?
So obviously we're Leo, but Laura I think does have, so Laura has some licensing and some things that they do. I think DHHS has some management and operational things that they do, and we're certainly trying to coordinate with everybody.
I jotted down some notes. You talked a lot about workplace stress prevention, healthcare workers, the stress on nurses. And then you talked a lot about, which was wonderful to hear, about the adverse reactions in childhood.
Yeah.
You said 4 or more adverse childhood reactions can cause trauma in people for the rest of their life. So I was wondering, when you did all of this studying, did you do any studies on any of the psychiatric-run hospitals in the state of Michigan, or anyone that was, as a state, as an employer, we're employing people in psychiatric hospitals to not only care for our adults,
Right.
but for our children?
Yeah.
Was there any studying on the reactions or the stress of those jobs
Yeah,
and how we could help?
Yeah, absolutely. So one of the challenges, so yes, we had DHHS with us the whole time, and we definitely talked about, as an employer, as how all of this, like it's not public and private, it's all of it. So we did have those types of discussions. One of the recommends that frankly we just haven't had the capacity to do was to break into industry clusters so we could identify specific stressors from industries. So nursing, healthcare was one. where you'd say, okay, what's going on in this industry, manufacturing, construction, all of that kind of stuff. Honestly, we just don't have the capacity or the people to do it. So that's why it's been held up a little bit. So we haven't gotten deeper, I guess, to answer your question. They were there. We definitely had discussions about it, but we haven't gotten deeper because we just don't have the ability.
I would love to see more of that because my office has done a deep dive into mental health resources in the state of Michigan. And I haven't received a lot of complaints about workplace issues, but I have received a ton of complaints about what's happening to the children at the Walter Reuther Psychiatric Hospital. And when you said brain fog and confusion, I thought about that, and I wondered if that stressor for those employees is what's possibly affecting those children from getting the care that they deserve, and the allegations of abuse that have been coming out of that facility and other state-run facilities. So engaging in that and doing some research for that, and I'd like to talk to you more about that.
Yeah, I would love to. I think State Police, Department of Corrections, as employers, do pretty good. State Police is like, their program is really, really good. Like, you think about those workers, nurses, you experience trauma because of your work, right? But in a lot of places, we don't talk about that. We don't deal with it. We just kind of go like, hey, take your shower, go home, and then come back tomorrow, right? So State Police actually has a robust program about dealing with the trauma that State Police endure because of the work and how you manage that and how you get healthier and all that kind of stuff.
We just have sorry to interrupt, but we just have a unique position where we have the ability to protect children in the care of the state. And your data showed that adverse childhood reactions can cause long-term effects.
Absolutely.
So working with state departments on the children that we are caring for in the state of Michigan and the employers that we're employing, that really, I would like to see more attention to that. If you could do that, that would be wonderful.
Appreciate it.
Thanks, Rep. And we know, I mean, this is part of the reason why I was so excited that Randall reached out, that we have Leo coming in, is we know there are so many facets of this.
Yeah.
Vicarious trauma is just one part of, it is an additional part of this for some of the folks who the state employs. And so there's a lot of work to be done in a lot of different sectors and facets. The fact that you all have taken the lead on this and done this deep dive is, I think, reflects that commitment to want to make a difference and do something. So I'm grateful for that.
Appreciate it. Thank you.
Rep. Reingans.
Thank you so much, Chair. Thank you so much for being here. I'm really passionate about this topic. Previously, I worked at the Michigan Department of Health and Human Services in the behavioral health area. And before that, I worked in health policy. And my husband's a mental health therapist specializing in trauma therapy. And he's now being a trainer in a really rapidly increasing therapy that addresses trauma and actually helps build resilience and helps people move through traumas that they've experienced. So I think what's really great to keep in mind is that traumas that we may have experienced, we are able to build resilience and move through them. And even though, I'm a person with multiple ACEs from my childhood, and my brain probably is different than it would have been had I not experienced so many ACEs. But I'm so grateful that I've been able to access treatment and therapy and able to move through some of those experiences and now be resilient and effective in my older life. So I think thinking about our staffing in various facilities and the people who work and are treated in various facilities, I think there is hope and ability and options for us to be able to help folks move through their traumas. So I'm really glad that we're talking about this as a workplace issue, and that we're able to understand as committee members that traumas and mental health issues can ebb and flow and that we can move through them and they're not permanent necessarily. So I think that's really great that you're talking about this, especially, as you said, a person who isn't from the mental health space. It's really great to hear that. One thing that I've been hearing a lot about in my district, it's pretty rural. We have a lot of agricultural activity and I'm a mom of a kid in a school, so I'm hearing from a lot of other parents in the school about the effects of climate change on so many parts of our industries in our state. Farmers are worried about not being able to predict these very extreme weather situations that keep happening and storms that are more frequent. and this is a pattern. This isn't just like one year, there's more storms than last year. This is a pattern that has been increasing. So this is the kind of thing that I was thinking you were talking about when you mentioned the climate impact on depression and anxiety. Is that some of what you were talking about? There's also the workers who work in those
as
spaces.
this work group, like we didn't take a position on climate change, right? We just recognize that people are dealing with that. It's causing stress, and whatever however your views are, is causing stress. It doesn't matter what.
Well, I
side
mean,
you
another
are.
example is in the news recently, there's been a report about how the home insurance industry is actually becoming broken
Yeah.
because they can't
Yeah.
actuarially make insurance work when they can't predict how severe flooding is going to be in any one year.
Yeah.
And that is a thing that stresses out families.
Yeah. Absolutely. Yeah, we agree. I think
It's a fact. It's true. It's a
Yeah.
thing that you can't argue with, I just would say. So, yeah. So I guess the workers that you're trying to serve are experiencing these things, and it's not like some farce is where I'm going with this.
Yeah, and for what we're trying to do on it, we didn't have to take a position on issues, right?
Sure.
We're not taking a position on issues. It's just the work needs to be done, and wherever the trauma comes from is wherever the trauma comes from.
So the
I
thing,
appreciate that. As the layperson, I would only add one thing I really love is telling people that there's nothing wrong with you. Like, this is normal stuff. This is how people are. This is how humans are. This is how I am, and kind of being able to break stigma as well. So I appreciate that.
there are a couple of things that you were talking about, all of you were talking about, and I just wanted to uplift them. I actually wrote down EAPs before you got to them because I feel like as a mental health care provider, I feel like the prevalence of EAPs and their presence in by employers was much more prominent decades ago. I don't know what happened. I don't know why they got kind of stuck in those binders. Why, but they are an essential tool
Yeah.
for folks, like to be able to have access to and they do so much. I mean, I used to know about EAPs who did everything from a couple of sessions of therapy to helping you with wills to childcare, like getting connected with childcare. I mean, they can be this amazing resource hub that sometimes just sits there. And folks don't know. So I'm so glad that you talked about that and that recommitment to really elevating those EAPs. The other thing that I was wondering about, and maybe it's done in those cohorts that you were talking about, is I do think that educating folks, and when you have more than one person who at an organization who knows about this, I think it helps. Kind of, there's a ripple effect.
Yeah.
Is that mental health first aid? When folks can start to learn, not that they're not doing therapy, but they
Right.
can start to learn how to recognize when the person in the cubicle next to them or on the line next to them or out in the field next to them is struggling, to help connect them. That makes a difference. And so I really think that mental health first aid, that kind of, opening that door and giving the permission for folks to talk about this, I think is really important. And the example that it sets is really important. Yeah. It's really important. And that's one of the things that we actually talked about in our veterans, Rep. Conlon chairs our Veterans Policy Committee, and she just really ushered in a package of bills for veterans and mental health. And we had Representative Bruck and Representative Bazat talk about their experience as veterans just earlier this week, and them as a model to for other vets to know it's okay to talk about this. There are there's major trauma that we deal with, and it's one of the things that we talked about, and I thank them for being that example. And I just think we can do more of that in our workplaces. The final thing that I wanted to bring up, and you didn't touch on, but I'm so curious about, is the proliferation of these things. And how they have blurred the lines of work and home.
Yeah.
Right? So everyone now has to be accessible all the time. And that becomes, I feel like, the expectation, unless whoever's at the top of the organization says, no, we're setting boundaries.
Yeah.
But when you have, for example, a boss who will respond at 3 a.m. to something or write an email or do, and that becomes normalized, then employees, there's an expectation around that, right? And so I think that lines have gotten blurred around work and home, and we just are so we're just too accessible.
Absolutely.
Right?
Yeah.
And I think that has a direct impact on mental health.
Yeah, we do. So if you go to a plug here, michigan.gov/workplace mental health, all of our webinar stuff. And just a couple of months ago, we had Colorado State University on talking about, and before that, Willamette from Oregon talking about technostress.
Yes.
Calendars, connections,
Yes.
kind of all that kind of stuff. So
Yeah.
I think we're definitely trying to address those issues. I
Great.
think I often ask myself, am I old enough for a jitterbug? I can't figure
Oh
it
my
you know,
gosh,
so I
that's
can-
funny.
Can I get a flip phone? So yeah, I think we would agree, and we're definitely
Yeah,
trying to touch
that's
this. We
great.
try to make sure like we're hitting some of those pillars.
Yeah.
So we'll talk
Yep.
in our webinars today. We're doing the Social Worker Association of Michigan.
Oh, yeah.
And
Yep.
we're going to be talking about how we help the helpers, like things
Yeah.
that we should
Yeah,
be thinking
that's
about
right.
to help social workers.
That's right.
So,
Yeah. Yeah. Well, and I think the other thing that you've talked about, and we have had before us, and we have worked on, are issues around parity, issues around workplace, and getting more mental health care providers
Yeah.
into the workforce to be able to help. Also, as a piece of this puzzle.
yeah.
And so I just want to say, colleagues, are there any other questions before we wrap up? Okay. I just want to say I'm so grateful. This was amazing. Thank you, Randall, so much for bringing it to us and raising the awareness around this, of the work, the incredible work that you all are doing. Colleagues, I really feel like it's important for us to know because, there are legislative ideas in here, there are appropriation ideas in here that we need to know about. And so I am grateful to you all for bringing this to us, for being experts in this, for caring about it, and making sure that we're doing the right thing by our employees throughout this state. So thank
Yeah,
you.
Thank you for having us.
Yeah.
Really appreciate it. Thank
Thanks
you.
so much. All right. Rep. Reingans. No, you got to move the minutes. Rep. Pahutsky moves to excuse all absent members. And there being no further business before the committee stands adjourned. Thanks, everybody.